Hey everyone, this is Sanskriti from Molecular Detectives. Here, I share information about cancer, from the molecular level to things in our daily lives and environment that affect cancer development. My goal is to explain the intriguing science behind cancer in meaningful episodes that will help you understand preventative measures, cancer science, and treatment methods, and ultimately for you to make evidence-based decisions to minimize the risk of cancer. Thank you for joining me in today's episode, and I hope you enjoy. Chemotherapy remains a cornerstone of cancer treatment. But how does it actually work? In this episode, I'm going to explain the chemistry behind drugs that kill fast-dividing cells, the side effects that come with them, how they've adopted and become more effective and bearable over time, and what the future of chemotherapy looks like. Let's get started. Chemotherapy is one of many cancer treatments that treat cancer. It works by killing cancer cells and stopping the growth of cancer using chemicals. The definition of chemotherapy is literally chemicals, chemo, treatment, therapy, or using chemicals as a treatment. Chemotherapy is usually used in combination with other types of treatments, sometimes as a two-step process or as a backup process. Chemotherapy is generally used for three reasons. The first reason is obvious: to treat cancer and to make sure that the cancer doesn't return. This is also called treatment with curative intent. The second reason is to control the cancer. This could mean to slow down cancer growth or to try to shrink the tumor. The cancer may not completely go away, but it could help patients live longer, and the disease would become more like managing a chronic disease like diabetes. So the cancer could go away, but it may come back. The third reason is to ease cancer symptoms, which can be thought of as treatment with palliative intent. Cancer is an excruciating disease, and tumors can cause lots of pain and impact organs in surrounding areas. Palliative chemotherapy targets the tumor to help some of the pain go away. This treatment can be used at any stage of cancer, and it isn't really used to kill cancer. This chemotherapy is often used even if the cancer has spread. Now, let's rewind back to when chemotherapy was first developed and when it first started being used. According to the American Cancer Society, the only types of surgeries that were curable early in the 20th century were cancers in the form of small tumors that were in localized areas, meaning that they were only present in a specific part of the body. Then, radiation became recognized as a treatment and was used after surgery was done on the body to remove any remaining tumors that were too hard to be surgically removed. Chemotherapy was first discovered by Sir Paul Ehrlich in 1909 when he discovered that syphilis could be treated with an arsenic compound called arsphenamide. Fast forward to 1943, during World War II, when a U.S. ship that was carrying a secret cargo of mustard gas shells exploded on impact. Military personnel suffered many burns, which caused many deaths. While performing autopsies on the soldiers, doctors noticed that the mustard gas killed the soldiers' white blood cells, which are cells that divide very often and quickly, and this led them to wonder if mustard gas could be used to kill rapidly dividing cancer cells. The military then hired pharmacologists to study mustard gas. Eventually, two Yale pharmacologists, Alfred Gilman and Louis Goodman, experimented and determined that nitrogen mustard could be used to reduce tumor growth in a patient who had non-Hodgkin's lymphoma. The patient was a 48-year-old man who was in the last stages of lymphosarcoma. Doctors tried all existing treatment options on him, but none were working anymore, and radiation no longer had any effect at all on his tumors. He was the first person in the world to be treated by chemotherapy, and this was a trial of the first chemotherapy drug, nitrogen mustard, or meclorethamine, and that was successful in treating lymphoma. It did this by damaging the DNA of rapidly growing cancer cells. Although the patient was given 2.5 times the normal dose, because at that time doctors didn't know how much was needed, the tumors still got softer and were completely gone by the end of his treatment. Unfortunately, he did relapse later on, but the success of the treatment itself showed doctors that there was another weapon to fight cancer. After World War II, Sidney Farber, a pathologist from Harvard Medical School, researched a chemical compound called folic acid, which is important in cell growth and helping the body make new cells. From this, he determined that aminopterin, a compound related to the vitamin folic acid, helped children with acute leukemia go into remission. This means that cancer growth slows or stops and symptoms go away. It does this by blocking an important chemical reaction needed for DNA replication. Metastatic cancer, which is when cancer spreads from the part of the body that it was in to other parts of the body, was cured in 1956 using a chemical compound called methotrexate, which cured a rare cancer called choriocarcinoma, which is a cancer that grows on a woman's uterus and can happen during or after pregnancy. This was a big accomplishment because people could now actually have hope of at least having better results in treatment, if not being completely cured. In the 1960s, the treatments of patients with Hodgkin's disease and childhood acute lymphoblastic leukemia were successful, and more people were being cured. In the 1970s, many patients with testicular cancer were also being cured. Over the years, doctors and scientists researched and trialed with more chemotherapy drugs such as vinca alkaloids, which could be used for leukemia patients. As research on chemotherapy kept increasing, doctors started using combinations of different chemotherapy drugs. This meant that more than one chemotherapy drug could be administered to patients for better outcomes. Since 1990, patients have been having much more improvement and mortality rates have been declining. Chemotherapy is very painful and has many symptoms of its own, such as fatigue, nausea, and vomiting. But in the early 1990s, serotonin antagonists, which are a class of drugs that block stimulation of the nausea receptors in the brain, became known to help patients with nausea, therefore improving their chemotherapy symptoms. Some examples of these drugs are Zofran, Eloxy, and Kitro. As you can see, chemotherapy has come a long way over the decades. Now, more approaches are used to reduce cancer growth, improve the effects of chemotherapy, and reduce chemotherapy side effects. According to the American Cancer Society, these approaches can include new drugs, new combinations of drugs like I mentioned before, and new delivery techniques. Some may be drugs and agents to more specifically target cancer cells. Some may decrease drug resistance so that drugs are more effective at killing cancer cells, and some can reduce side effects, such as chemoprotective agents and antiemetics, which reduce nausea and vomiting. For most people, the word chemotherapy brings pain and dread to our minds, and honestly, just imagining having to go through chemotherapy makes me feel nauseous. There can be so many side effects of chemotherapy itself, which can make it feel like chemotherapy is mentally and physically targeting you and not the cancer itself. However, nowadays there are many new and improved chemotherapy drugs that are more effective, and other drugs that reduce pain and nausea. Chemotherapy today is not as painful as it used to be many years ago. According to the MD Anderson Cancer Center, there are more than 100 chemotherapy medications to target most tumors, and there are many new ways of delivering the drugs, such as covering them in bubbles to cushion absorption or latching them onto proteins that specifically target tumors and avoid healthy cells. These methods help reduce many side effects of chemotherapy and help patients feel much better, at least compared to previous years. Now, let's talk about how chemotherapy is administered. Chemotherapy can be given in many different ways. Some have minimal initial contact with the body, and some involve surgery. You can get chemotherapy orally in the form of pills, capsules, or liquids that you can swallow. This is one of the most least painful ways to receive chemotherapy. You can also get it intravenously or through IV, which is when the chemotherapy drug goes directly through a vein. This is one of the most common ways to get chemotherapy and is known as IV chemotherapy. You can get it as an injection through a shot in your arm, leg, or belly. You can also get intrathecal chemotherapy, which is when the drug is injected into the cerebrospinal fluid surrounding the brain and spinal cord. Intraperitoneal chemotherapy is given directly into the peritoneal cavity, which is a space within the abdomen that surrounds organs like our stomach, intestines, and liver. Intra-arterial chemotherapy is given into the artery that directly leads to the area where the cancer is growing. Topical chemotherapy is in the form of a cream or lotion that you can apply on your skin. This is a common treatment that's used for skin cancer and is a painless way to get the treatment in your body. Since IV chemotherapy is the most common way of getting chemotherapy, you're most likely to get it through a needle, a catheter, a port, which is placed under your skin during surgery, or a pump, which is usually attached to a catheter or port. Now, let's discuss classes of chemotherapy drugs. Some chemo drugs may belong in more than one group. The first group is alkylating agents. They keep the cell from reproducing by damaging DNA. So other genes recognize the cell as dangerous to reproduce, so they don't allow these cells to divide, and this slows down tumor growth. According to the American Cancer Society, these drugs work in all phases of the cell cycle and can treat many cancers, like lymphoma, Hodgkin's disease, lung cancer, and breast cancer. The next group is nitrosoureas. Unlike alkylating agents, nitrosoureas can travel to the brain because they're able to go through an area called the blood-brain barrier, which is hard for most drugs to do. Because of this special capability, these drugs are used to treat many brain tumors. Next is antimetabolites. These drugs are used to treat leukemia, breast cancer, ovarian cancer, and other types of cancers. They act as substitutes for nucleotides that are used to build DNA and RNA, and because of this property, DNA isn't able to replicate, so new cells can't form. Anti-tumor antibiotics change the DNA inside cells and interfere with enzymes involved in DNA replication so that cells can't reproduce. They're used for a lot of different types of cancers. Don't confuse these with antibiotics used to treat infections. Topoisomerase inhibitors, which are also called plant alkaloids, mess with topoisomerase enzymes, which help separate DNA strands so that cells can't reproduce. These drugs treat leukemias, lung cancer, ovarian cancer, gastrointestinal cancers, and others as well. Mitotic inhibitors are also plant alkaloids, and they also stop cells from reproducing, and they also stop enzymes from creating needed proteins to help cells divide. Finally, corticosteroids, or steroids, are natural hormone drugs. They assist with apoptosis but are mainly used to help people feel better and increase energy levels. As you can see, many chemo drugs work to halt DNA replication, which makes cells not able to reproduce. It's like targeting two birds with one stone. I know I already talked about side effects of chemotherapy, but let's go a little more into detail. Some chemo drugs kill cancer cells, while others stop them from reproducing. But the big problem is that chemo drugs can't tell the difference between healthy cells and cancer cells. Because chemotherapy is a systemic treatment, it travels through the entire body instead of just local treatments that only target one part of the body. So, healthy cells often also get damaged along with cancer cells. That's why patients going through chemotherapy have hair loss, mouth ulcers, nerve damage, and other symptoms like fatigue, nausea, vomiting, and diarrhea. The drugs affect almost every single cell in the body. It's important for doctors to consider this when determining the sizes of doses for their patients. The good thing is, though, that the symptoms go away after chemotherapy is over, because normal cells can recover and start growing back. Also, the drugs and approaches I mentioned before help with reducing symptoms. Now, let's take a sneak peek into the future. What is chemotherapy going to look like? Doctors are looking to pair chemotherapy with immunotherapy. Immunotherapy is a very important treatment, but it doesn't replace chemotherapy. Using them together, however, can cure more cancers. According to Michael Keating, a professor of leukemia, chemotherapy can be used to shrink a tumor, and immunotherapy can be used to completely eradicate the cancer. Pairing both treatments together would make them both more effective. This was an information-packed episode. I hope you enjoyed listening about chemotherapy and how it works, the history behind it, the different types of chemo drugs, side effects, and what the future holds for chemotherapy. That's it for this time. Thank you for watching, and please stay tuned for the next episode.